Rheumatoid arthritis rarely arrives alone. In most patients, it is preceded by years of seemingly unrelated symptoms. A thyroid that was called normal but wasn't. A viral fever that never fully resolved. Recurring fungal infections that nobody took seriously. In this video, we show you how these three hidden accelerators connect directly to your autoimmune disease, and why no single specialist is equipped to see all three of them at the same time. Why does thyroid dysfunction appear in the timeline? Autoimmune diseases cluster. If you have one, you're at higher risk for others. This is because they share common genetic susceptibility alleles and similar mechanisms of immune dysregulation. But there's a deeper connection specific to RA. Thyroid hormone regulates immune function. It influences T cell maturation, B cell antibody production, and macrophage activation. Subclinical hypothyroidism, even with normal TSH of 3 to 4, creates immune dysfunction. Your Treg cells don't develop properly. Your Th17 cells become overactive. Studies show that RA patients with thyroid dysfunction have worse disease activity, higher inflammatory markers, and poorer response to treatment. Yet, conventional rheumatology almost never optimizes thyroid function in RA patients. They check TSH. See, it's under 4.5 and say, your thyroid is fine. But it's not fine, it's suboptimal. And that suboptimal thyroid function is directly contributing to immune dysregulation. Now, why did her joint symptoms worsen after the viral fever? Certain infections are known triggers for RA development or flares. Chikungunya virus directly infects synovial tissue. In some patients, the viral arthritis never fully resolves and evolves into chronic inflammatory arthritis indistinguishable from RA. Studies from India show a subset of chikungunya patients develop positive arthritis with positive RF and anti-CCP. Epstein-Barr virus has multiple studies linking it to RA pathogenesis. EBV-infected B cells in synovial tissue produce ACPAs. The virus also has proteins that mimic citrulinated antigens, triggering cross-reactive antibodies. Porphyromonas gingivalis. This periodontal bacteria is the only organism besides humans that produces PAD enzymes. It citrulinates proteins in your mouth, training your immune system to produce ACPAs that then attack your joints. Mycoplasma, chlamydia, and other intracellular bacteria can persist in synovial tissue, creating chronic low-grade infection that drives continuous immune activation. This is why infection history matters. The viral fever 6 years before RA diagnosis wasn't coincidental. It was a trigger that amplified the autoimmune process. Why do fungal infections appear in this timeline? Chronic fungal colonization indicates immune dysfunction. Your innate immune system, specifically neutrophils and macrophages, should clear fungal infections quickly. If you have recurrent fungal infections, it means your immune system is either depleted or misdirected. The same immune dysregulation that will eventually cause RA is already evident in your inability to clear fungal organisms. Additionally, fungal cell wall components like beta-glucans and mannans activate pattern recognition receptors on immune cells, creating chronic low-grade immune activation. This contributes to the inflammatory milieu that promotes autoimmune disease development. Do you see how it all connects? Gut inflammation leads to immune activation. Immune activation leads to thyroid dysfunction. Thyroid dysfunction worsens immune regulation. Infections trigger molecular mimicry. Fungal colonization indicates and perpetuates immune dysfunction. Each piece feeds the others. Each unrelated symptom is actually part of the same underlying process. And conventional medicine treats each piece separately. Different specialists, different medications, no one connecting the dots. In the next part, we'll decode the blood work. We'll show you a real patient's full panel and walk you through 7 distinct metabolic dysfunctions that were hiding in plain sight. Iron deficiency masked by inflammation. Hashimoto's missed because the TSH was under 4.5. Severe vitamin D deficiency with secondary hyperparathyroidism. Her rheumatologist was treating one of the 8 problems. And if you want the complete picture, the full 2-hour RA masterclass is linked in the description below and pinned in the comments.